Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights. President Buhari advocates for uninhibited supply of safe coronavirus vaccines to all at the United Nations General Assembly, seeks inclusive response to the pandemic. Taraba government says it has no active case of COVID-19 and no recorded fatality as it introduces the next phase in response to COVID-19. And global airline sector recommends mandatory COVID-19 tests for departing passengers to replace quarantines. Now, according to the Nigeria Center for Disease Control, the Nigeria International Travel Portal is live and is reminding travelers who are departing from Nigeria that the requirements for COVID-19 PCR negative tests depends on the airline and the travel destination. It says a properly worn mask acts as a protective barrier to prevent the spread of COVID-19. The Center for Disease Control announced 176 new confirmed cases reported from 13 states, including the Federal Capital Territory. The highest was recorded in Lagos with 73, followed by Plateau State, 50 cases, and the other states there you can see on your screen. In the last 14 days, between the 8th and 21st of September, Nigeria recorded 2,157 coronavirus cases across the country. Till date, 57,613 cases have been confirmed, 48,836 of them have recovered, and 1,100 deaths has been recorded in the 36 states and the FCT. South Africa, which accounts for over 50% of the cases on the African continent, has recorded 126 deaths in 24 hours, putting the death toll at 16,118. The cases are reported from the following areas: the Eastern Cape, KwaZulu-Natal, Gauteng and Northwest, and also from the Western Cape. 593,000 persons have recovered of the 663,000 cases confirmed in the country. 16,394 tests have been conducted since the last report, putting the total tests carried out in South Africa at over 4 million. In the meantime, global coronavirus deaths inches towards the 1 million mark. Well, in the meantime, the Nigeria Center for Disease Control has updated its sample collection site on its website with the latest Kano State uploaded. You can see there. You can also find a list of other states like Jigawa, Zamfara, and of course the Federal Capital Territory, the local government areas where the collection sites are located, the wards, plus of course contact numbers as well. The President is asking the United Nations to ensure accelerated development, manufacturing and uninhibited supply of safe and effective coronavirus vaccines to all parts of the world. In his address to the 75th UN General Assembly holding virtually, President Muhammadu Buhari pledged that Nigeria will partner with the UN and some other countries to achieve the target on COVID-19 vaccine. He also emphasized the need to jointly solve the scourge of poverty, particularly in developing countries, disarmament and terrorism, climate change, human rights abuses, corruption. President Buhari called for inclusion, collective action as members of the international community, insisting that Africa deserves permanent seats in the UN Security Council.
The international community will need to cooperate in addressing the scourge of poverty, particularly in developing countries. It is in this regard that we commend the President of the 74th General Assembly for launching an alliance for poverty eradication in June. We encourage global leaders, particularly leaders from the global North, to support the alliance at this time when the coronavirus pandemic is reversing gains made in the achievement of the 2030 Sustainable Development Goals and pushing an additional 500 million people into extreme poverty.
The Lagos State government has received a donation of over 100 palliative packs to be distributed to the less privileged in the state. The state coordinator of the coalition against COVID-19, Mr. Amici Okobi, commended the Lagos State government for its efforts in managing COVID-19 pandemic, also appealing to the governor to ensure that the palliatives get to those in need of support. Speaking on behalf of the state government, the acting commissioner for agriculture says the items, over 100,000 of them, the packs will be distributed through the local government representatives.
The idea here is to take care of our fellow man. 1,666,667 Nigerians need our help. All Nigerians could use our help, but we focused on the lowest 5% to ensure that in these extremely tough times, they're at least fed. We had lockdowns that prevented them from working, so this helps. Could we do more? We would love to. Could you do more? I know you would love to, but this is a start. It just basically says Nigerians for Nigeria are fighting this fight. Mr. Governor, the road is long and hard. The efforts to get this food and palliatives is gigantic. But to distribute this food is even more, because we know all the problems we would face. So, Mr. Governor, our ask on behalf of CACOVID is that you continue to support, to help us ensure that every last Nigerian that the Commissioner mentioned gets these items.
According to the CACOVID team, Lagos State is supposed to receive 107,546 beneficiary packs for our citizens, for the indigent, for the elderly, for those that do not have the wherewithal or the capacity to have food on their table on a daily basis. Now, for this 107,546 beneficiary packs, each pack contains 10 kilograms of rice, 5 kilograms of gari, 5 kilograms of sugar, 1 kilogram of salt, 2 cartons of noodles, Indomie, and 1 carton of pasta.
Over to Kano State, where the Bishop of Kaduna Anglican Diocese, Most Reverend Timothy Yahya, has called on the federal and state governments to create stimulus packages to help poor households and small-scale businesses hardest hit by the impact of the coronavirus pandemic. In his message, the bishop notes that many vulnerable households are going through severe hardship. While lamenting the low budgetary allocation for health sector in the 2020 budget, the cleric calls for urgent upgrading and rehabilitation of healthcare institutions across the country, especially setting up of more testing labs to enhance the fight against COVID-19. Taraba State Governor Darius Ishaku says his administration will continue to expand testing and treatment facilities for COVID-19 in preparation for the next phase of its campaign against the disease. He was speaking when the state's Technical Committee on COVID-19 presented its interim report of activity since the advent of the virus in the state. According to the governor, the state has no active case of COVID-19, as well as no fatality recorded, of which he attributes to the early and adequate preparations made by his administration.
COVID-19 in Taraba. I complained bitterly that Lagos is not the only state in Nigeria, neither is it the only capital, and that Abuja is also not capital only. And there are some capitals like Jalingo for Taraba State. I see no reason why we will have testing centers dotted all over, and there is none in Taraba State. I'm very happy and delighted that the DG NCDC took up that challenge virtually immediately and helped by sending the consultant specialist to us here. And a very dynamic lady. I was in the hospital at about 8, 9 or 9 something. And we went around to supervise what she was doing. And she fixed up the first testing center. And she followed up the people that went to Takum, where they were able to convert or dualize the machine that is supposed to test only for hepatitis to now also test for COVID-19. These are efforts I think is quite commendable. I thank the NCDC DG for being prompt to respond. I also thank you that we're on ground here.
So let's talk some more with regards to the safety measures as schools resume across the country. Joining us in the studio is Dr. Aino Oyekomi, a psychiatrist. Good to have you join us again.
Thank you for having me.
Now, since the last time you came, school has since resumed. Lots of children are excited to be back. But with regards to some of the COVID-19 protocols, what have you noticed in terms of complying to the measures?
I think it's really a mixture of things. Some children would comply very well, willingly on their own, but for some, they have to be forced to comply.
So how do we encourage children to do this?
First, the school must not lose sight of their role in the development of children. I want to take it from there. In the ecological landscape of human development, the school is like a citadel of security, safety, and a place of nourishment, not only for academic materials, but also for their social and economic development. This is very, very crucial. Now, it's a new normal. The children will have to get used to the new culture in the school, to the new sanitary culture, to the new social culture. So they have to go through a process of acculturation, which can be quite stressful. So teachers must be aware of this. That's number one. Then, because of the new normal, the social interaction will be so much drastically reduced. And the schools can lose sight of the wholesome purpose of schools and only focus on the academic losses. You know, they want to rush them through their classes that they have missed, but they must not lose sight of their social and emotional development. Otherwise, these children will grow up to become like adults with what I call psychological kwashiorkor. That means that they have so much in the academic domain, but they are so lean in their social and economical development. So the teachers must be aware of this. So that's it. And then, so what can they do? There are some activities that they can do. There are some social activities. They should not rule out extracurricular activities and just focus on academics. There are a lot of social activities that they can do without social contact or with very, very minimal social contact, because all these things go into the forming of the minds of these young ones. Remember, the future of any nation is the children, and what happens to them today will define the type of adults they are going to become in the future.
But don't forget, there is the fear of COVID-19.
Yes.
So a lot of things, maybe like swimming classes, a lot of extracurricular activities have actually been curtailed.
Yes.
And so for maybe high institutions or universities, they're insisting that these students actually do a COVID-19 test. Would you recommend that? And this is vis-a-vis the fear of COVID-19 and staying.
There's no straightforward answer to that, really, because if you do a COVID-19 test today, it only certifies you that you are free today. What about tomorrow? So for that, it depends on the context. You know, we can't just give a blank answer. It depends really, really on the context. And then coming back to your question, yes, I said there are some social activities. You might not, I mean, they might cancel swimming, they might cancel, you know, hugging and all those things, but there are still a lot of social activities that can be done to compensate for that loss of physical distance, social interaction, because that social interaction goes a long way in developing us. And these children, they are still in that developmental phase.
So it's a lot of reliance on schools. How about the parents at home?
Yes. Parents also must be aware, because these children, you know, they've been at home for a very long time. Some were so excited to start school. Some were very, very reluctant. Some, they add mixed emotions. So parents too must prepare their children that, okay, when you go to school, you have to comply, you have to do this, you have to do that. And then the schools also must make that process very seamless, very fun, you know, for these children, so that they don't see it as a mammoth chore that, oh, every day we have to wash our hands, you have to sanitize.
Face mask. We'd like to thank you so much, Dr. Aino Oyekomi. Thank you for joining us on the program.
Thank you.
We have more on the COVID-19 update when we return. Please stay with us. Welcome back. The Bauchi State government is injecting 2.5 billion naira loan service to the health sector to resolve the numerous perennial challenges bedeviling it. Governor Bala Mohammed told members of the Nigerian Medical Association, NMA, Bauchi branch when he received them on a courtesy visit. The president of the association, Dr. Adamu Sambo, listed a number of challenges in the middle of the pandemic to include manpower shortage, poor welfare, infrastructure decay, inadequate working equipment, and others.
There is no how you bring a doctor for housemanship without a place to sleep. There is no how you cannot provide a medical quarters in a hospital and you expect to get a doctor on call. So all these gaps are there, and that's why we are declaring a state of emergency, and we are calling for a health summit to discuss all these challenges. We have taken inventory of all this, done the due diligence. At the end of the day, we will sit down. This is our capital requirement, equipment, personnel, and of course, this is the cost. This is what the state government can provide. We have leverage on the federal government incentivization, where we take loan at a single digit. We have already accessed 2.5 billion just for medical and health sector.
So we've taken a look at the psychology and tasks to keep learning fun. This is as schools resume. Our next guest takes a look at some of the infrastructural challenges that occur with the new normal. Dr. Modupe Akinka is a public health physician, and she joins us via Skype. Thank you for joining us on the program.
Thank you very much for having me on the program.
So first, we know that there is the challenge of infrastructure, and this is because of the current structure, and classrooms are expected to, of course, put in the physical distancing. When we look at the population for perhaps the public schools, for example, do you think that that can be achieved?
Yes, it can be achieved. Whatever it is we want to do can be achieved. And with them, what it would then mean would be finding a way to be able to reduce the number in the classes. So rather than having a full class, we would have a class with physical distancing so that the children are at least safer, which would also mean that either the children come to school in batches. They have morning school and they have afternoon school. That's for the public ones that may not have space. Then, of course, we should be thinking about building more classrooms. But for the immediate need right now, we may have to do things like that just to be able to achieve that safe number of students that would be in class, so that we don't put their parents and their loved ones at risk as a result of their return to school.
Another reality is the enforcement of the protocols. We've heard from state governments, their task forces and their agencies, but the question is, do they have enough surveillance manpower? Because, I mean, we need to monitor compliance and monitor compliance effectively.
Yes, manpower to be able to monitor compliance may be inadequate, but the thing there is that it is still possible, even with the little manpower or the manpower that is available. It's a question of, do we want to go there and actually inspect and find out whether these people are taking the required precautions. So it's a question of trying to work it out. They can't go to every school, so they would have to probably sample the school and then go to the selected schools and then use that to be able to judge others.
Finally, Dr. Akinka, some states recorded low turnouts of students. So some people are saying maybe there is a fear from parents, guardians, with regards to COVID-19. Take us through perhaps what families need to know and how the children can safely go to school and come back home without, of course, spreading COVID-19.
Yeah, so definitely parents will need to be reassured that when their wards or their children, when they go to school, that they will be safe. So the onus is on the schools to be able to communicate this to the parents as well, so that they can, tell the parents the measures that have been put in place. Are we going to enforce physical distancing in class? Are we going to be cleaning high-touch areas, like doors? Are we going to be leaving doors open? Are children going to have to go through hand hygiene frequently, all right, to ensure that they are safe in school? Because it's a two-way thing. The children have to be safe going to school, being in school and coming back. All the whole thing about going to school. And then the children also need to be safe when they get back from school. So when they are in school, if all of the measures are put in place and parents' minds are settled, or they are, the school has given them the confidence that this will be done, then they also have to, of course, talk to their children. They have to wear that face mask and fully keep wearing them. So they have to ensure that the children have a comfortable face mask, so that at least it will be convenient for the children to wear them. And then once they get back from school, then of course they shouldn't touch anything until they have removed the face mask from
wash their hands. All right, we'd like to thank you so much. We've been speaking to Dr. Mudukwe Akinka, a public health physician. Now, from the global scene, the airline industry is pushing for coronavirus tests for passengers before embarking on international flights. Travel restrictions have crushed the sector that says pre-flight tests will be better than quarantine. Here's more on the global update.
Global airlines are calling for airport COVID-19 tests for all departing international passengers to replace the quarantines they blame for exacerbating the travel slump.
We propose to have an alternative measure that would replace quarantine, which would be testing all passengers at before departure, and preferably at departure airport. So a systematic testing of all passengers at departure would guarantee that you fly people who are not infected by the virus, or with the risk of being infected, which is very, very limited by the sensitivity of the test.
France is seeking ways to ease delays in obtaining COVID-19 results amid a demand that has climbed for PCR testing as the country reaches nearly 1.3 million tests per week. New testing centers for people with symptoms and those who have been prescribed to undergo the procedure have opened this week in the Paris region. The government is also looking at other testing techniques to help alleviate the bottlenecks.
We followed the guidance to the letter.
On Tuesday evening, British Prime Minister Boris Johnson, in a televised address to the nation, said that he is reluctant to infringe anyone's freedom, but people must follow the rules and prevent another national lockdown.
But we have to acknowledge that this is a great and freedom-loving country, and while the vast majority have complied with the rules, there have been too many breaches, too many opportunities for our invisible enemy to slip through undetected. The virus has started to spread again in an exponential way. Infections are up. Hospital admissions are climbing.
And finally, Russia is proposing a high-level conference on vaccine cooperation. President Vladimir Putin made this known during his UN General Assembly speech. He also asked that the World Health Organization should be strengthened to coordinate the global response to the pandemic. Russia was the first country to grant regulatory approval for a vaccine and did so before large-scale trials were complete, stirring concern among scientists and doctors about the safety and efficacy of the shot.
Visit our website for more stories. Take a look at the updates on the pandemic, plus several other stories as well. That's channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay safe.